over to Rebecca. And Rebecca, if we can ask you to introduce yourself, start off by introducing yourself and then carry on with your presentation. Thank you very much.
Hello, thank you, Gary, for that. Good evening, everyone. It's a huge pleasure to be here. Very nice. Thank you for inviting me back. My name is Rebecca. I am a GP trainee, hopefully becoming a fully qualified GP in a year's time. That's the plan at least. And I live in Kent, and I have a special passion for lifestyle medicine, which is a non-invasive way of preventing or treating chronic illnesses using sort of healthy means. It does include, of course, exercise and diet, but it also includes other topics that you guys have been addressing, such as sleep and fresh air, plenty of water, and all these things. And so we do have that acronym called New Start that kind of summarizes things. So today we're going to cover exercise, which is really one of my favorite ones. I can't pick between the nutrition and the exercise bit because I'm really passionate about both of them. But exercise is just, it is something so much fun. It gets people moving. It brings people together. Exercise is not something easy, but it's very rewarding and it's fun. And so I hope that you guys can share this excitement with me. And I hope that by the end of this, we may have learned a little bit more and be inspired indeed and excited to get active. I am going to give you a little bit of scientific scientific reasoning behind the art of exercising and some of we're going to go over some of the benefits and some also give you at the end a little quote unquote exercise prescription at the end and some tips of what research tells us is most effective and best when it comes to this topic. So I will start sharing my screen with you now so you can see my slides. And if anybody has any questions at any point, of course, we will do questions and answers at the end of when I finish my slides. But feel very free to raise your hand, pop a comment in the chat, or just unmute yourself and ask a question at any point. It's absolutely fine by me as well. I'm sure. And when I'm sharing my screen, I'm not sure if I'll be able to see when people raise their hands, but I'm sure Gary will be helping me to liaise and keep an eye out on that. So let me go ahead and start sharing. Here we go. Let's see. Hopefully everyone can see that.
Yep, we've got that.
Perfect. Yep. All right then. Okay. So exercise. It comes in so many different forms, different shapes. The variety is just huge. It's just moving really. And in fact, even stretching comes under this topic because it does also we benefit from even stretching, just moving our joints, moving our body. That is part of it. So it's something I will talk about. So I'll just move my thing a little bit. So is exercise as good as medicine? So some people say that it is an intervention that can actually replace drug therapy and is even more efficacious, and with the added benefit of the fact that it has no side effects. And in fact, all the side effects from exercise are really great ones and ones that we welcome, really. And in fact, you know that the Bible actually talks about exercise too, and it calls it the river of life or the life of the flesh, depending on which version you're talking about. And it's interesting because I've never seen that definition anywhere else. And I think it's so accurate because indeed it pretty much, if you like, irrigates the entire body. You know, it irrigates all of our cells, all of our organs, and it carries the good stuff in and it takes the bad stuff out, which is just brilliant. And that is amazing because it will take the oxygen, the nutrition, immune cells, and it will take away all the waste, the carbon dioxide and the free radicals and all these things. Some people say he who rests rusts. And you know, it's true. They have done a lot of studies recently as well with just how bad for our health it is to live the sedentary life that we do live, and just sitting down for so long. Yes, and so we're going to talk more about that later as well. I don't know if anybody has heard of Dr. Neil Nedley. He is actually pretty much, if you like, the father of New Start, because the institution that he runs in America was where the acronym was created and where it really originated, where it began. And he treats a lot of different illnesses there with all sort of natural ways, but he has a special depression program that he's very famous for, and it's called Depression: A Way Out. He has a book and a website just about that. So if you Google that, you will find a lot. And interestingly, so he prescribes exercise to people, and this is something that as a doctor I can do too, which is we call it social prescribing, which is when you prescribe people outdoors time, you prescribe certain foods, you prescribe exercise time. And he says that some of the people who have the most severe cases of depression, they can be prescribed up to 7 hours of exercise a day. Of course, not all of those would be super intense, you know, not all 7 hours of high intensity exercise. However, he does prescribe some form of physical movement for those periods of time. The average prescription that he gives for his depression patients is 3 hours in average. And so you can imagine just, if you're ever feeling gloomy, feeling down, feeling anxious, feeling worried, feeling sad, just exercise, get moving, because it is exhilarating. And we're going to see why. Some of the benefits, I think, generally speaking, we all know that exercise is good for us. We have an idea of the benefits. We know about the feel good hormones and that you can lose weight, you know, everyone. But I just would like us to just go a little bit deeper today, if that's all right, that we see even more, even looking further and deeper into what these benefits actually are and what they represent to us. So, enhances our metabolism, yes. Our cells start working quicker and faster. It burns energy. However, somehow it also makes you more energetic. We can talk about that again. And so it enhances the functions and the blood flow to organs, all right? And so that's what we said. It brings in the good stuff, takes away the bad stuff. And so actually, when your organ is irrigated, nourished, it can work more optimally. And so it reduces infections and anxiety. And that's what I mentioned, Neil Nedley, how many hours of exercise he prescribes. It stimulates our digestion also. I have met lots of patients that I've tried treating for constipation before. No matter, you know, they were not improving, no matter which kind of laxatives and how many different laxatives we would put them on, or people, and these were people who were not able to really get a good grasp on their diet. But as soon as they start moving a little bit more, getting around, moving a bit more, that would do the trick, which is very interesting. And it is important for stimulating the movement, the peristaltic movement of our intestines. It, of course, strengthens our muscles, bones, tendons, and cartilage. So interesting. There's a fine balance here, because some people say, oh no, I've got bones problem, I've got joint problem, or I've got, osteoporosis, osteoarthritis? Well, it depends what kind of exercise. You are not advised to stop it completely. Rheumatologists, who are the specialists in joints, really, they would always say, reduce the exercise, adapt it, change it, but never stop. It is, you have to be careful. And again, this I say this, and I make a disclaimer because it depends on a case-to-case basis. It depends on that person's age, the different underlying condition that person has. So I'm not saying here a bedridden 98-year-old, now let's suddenly just make them, force them to exercise. We're not saying this, of course. It's from on a case-to-case basis. So because what happens, the reason why, so the cells are fed by the load, what I mean is actually bone is stimulated to replicate when tension and weight is added to it. There are the other things that stimulate our bone cells to reproduce and replicate, but exercise is one of them, definitely. And so the impact and the strength that are exerted on the bones via our tendons, they are so not only any kind of impact on the ground, but also when you are just lifting weights. Let's say if you are even, let's say, doing bicep curls, you are tensing your biceps, which is stretching your tendon that's connected to your bone, and therefore it will actually make your bone, the humerus right here, it does make it stronger, the bone. And so that's important because, of course, osteoporosis and arthritis, especially osteoporosis, is really by a loss of bone matter, is when sometimes you look at the bone and it looks like a sponge, and it looks like a Swiss cheese kind of thing. But so actually it is an advantage, and it is we like for those bone cells to replicate and multiply because it will strengthen the bone, and it can increase bone health if this is done appropriately and carefully and correctly. Okay, and so that's why we will get on to more later. There's someone will be coming to talk about practically, actually give some examples of some things that we can do. It strengthens our heart, so important, because you see, the heart is a muscle, and interestingly, as you train, you're literally training the muscle of your heart, because your heart will be pumping faster. Essentially, it is contracting more often, and it is becoming stronger, and therefore with each squeeze of the heart, more blood will be ejected from the heart. And so actually your heart will be stronger, more effective, more efficient. And therefore later, when you're not exercising, when you're at rest, your pulse will be lower because your body will adapt and notice that it needs to pump less times in order for blood to be distributed everywhere, because each pump is stronger and each contraction is pushing that blood further. And it enhances cognition of the brain, absolutely, because again, it sends more blood and better and fresher blood to the brain, full of oxygen, and it does definitely enhances this health of our brain cells as well. It's very important in the hormonal system. Not everyone realizes that. Okay, we think about, I'm gonna burn fat and build muscle, and that's it. And not really. It affects it affects our hormones very much, not only whilst exercising, but later on in between each session as well. So our endorphins, these are our happy hormones, the ones we all know about, the ones we love. Endorphins. So what do? They fight depression, they fight pain, and emotional disorders as well. Not only depression, bipolar disorder, personality disorders. It has been effective with patients with schizophrenia very much as well. And pain, very interesting, because actually when you have that adrenaline, which is a type of endorphin, is released, you actually feel less pain. And so some people say, oh, no, look, you look at that kind of exercise. That seems really painful and aggressive. I would not want, but actually the person who is in it doesn't feel it that much because they have those endorphins actively circulating in the bloodstream at that very point in time. And therefore they actually feel less pain. It is more painful to watch than to do sometimes if you're really into it and depending on the kind of exercise you're doing. It reduces our stress hormones. Yes, absolutely. And so it releases emotions. So there's a term called cathartic. And this is one of my favorite things about exercise that I have not been able to find anything else that can replace it just quite in the same way. Exercise is a very cathartic activity. What does that mean? It releases the stress. It releases your emotions in a way that it relaxes you. I don't have the actual dictionary definition here with me of cathartic, but I love it and it's amazing. Very good. And that's what exercise does to us. It is very cathartic. Is a way that you can just kind of forget about your problems, focus on something else, focus on something manual, physical. And by that means it relaxes you from your problems, your worries. It relaxes you're less tense. Funnily enough, you are tensing and flexing your muscles and putting strain on them. However, same time you're actually releasing your own tension. It normalizes the insulin levels, which of course is a very important hormone created by our pancreas. It's wonderful for diabetes. Not only it prevents, but absolutely cures diabetes. I've seen patients like that. It stimulates our thyroid hormones. It regulates sex hormones as well. And so it actually improves menopause symptoms. Women struggling through those times, they do find benefits of engaging in regular exercise activity and going into an exercise routine within those periods, those years of their lives. Improves sleep, yes, because again of serotonin levels, and not only that, but you also feel more tired and you just have a better night's sleep and you sleep very soundly afterwards. Has an anti-aging effect, absolutely. Why? Because it will supply and nourish your skin cells in an amazing, beautiful way. Yes. Did you know that some of us don't move enough to a point that there are parts of our body, certain cells that haven't received enough blood for ages? And so, even certain parts of our skin, they haven't been really flushed and out and our pores open up, the toxins are released. And in fact, a tip and an important thing is that I always tell my patients that try and have a shower almost straight after you exercise, because what happens is you have released a lot of toxins whilst you exercise, and they will be sitting on the surface of your skin. And if you go and take many hours before you actually manage to have your shower, sometimes there's enough time for some of those toxins to be reabsorbed back. So you want to really give it a good wash with soap, especially in the areas where you sweat the most. Give it a very good scrub and get rid of those toxins that are sitting there. Smokers actually find very helpful when they exercise, because some of the toxins are released through their skin and they start feeling less and less craving for cigarettes because they are detoxifying. And so this is something that has been proven. So it's I recommend that. Nobody normally talks about it, but it's a really important one. Right, cytokines. So what are cytokines, and what is this slide talking about? Adipose tissue, which is obviously fat tissue, is present in greater amounts in obese individuals. They produce something called pro-inflammatory cytokines and tumor necrosis factor, and they increase the circulation of reactive oxygen species. Okay, what is this? This slide is saying that actually obesity should the bottom line here is that obesity could actually be classified as a disease. And if I'll be honest with you, as a doctor, whenever we are meeting a new patient for the first time, if they are significantly obese, we list that as their past medical history, or as a comorbidity. And, we don't want to be discriminative, and we don't want to be we don't want this to come into any ethical issues with society or nothing like that. But as clinicians, from a physiological point of view, and when you're reading about a patient having not seen them before, it's relevant to us to put the whole picture together, to understand their different diseases, different illnesses that they have, because they impact each other. And so we list, let's say this is a person who is a hypertensive, who also has gastritis, and they've had a broken foot before, and they've done a cataract surgery. We will, in that same list of previous medical problems or current medical problems, we will list obesity. It's not a standard thing, it's not a requirement, but I have definitely seen in my years of working in hospitals and in GP surgeries that we do list that. And so essentially why this slide explains, because actually it is like a disease. The excessive amount of adipose tissue in people's body is actually releasing very unhealthy things, and it's a state of inflammation. A person who is obese is essentially in a state of chronic inflammation. And unfortunately, the fat cells, they will be releasing these hormones here, and these neurotransmitters, and these chemicals essentially will be releasing them. Tumor necrosis factor, can that contribute to the development of cancer? I'm afraid so. And pro-inflammatory cytokines. Disease is a state of inflammation always, pretty much, no matter what it is, whether it is a bug that got into us in the form of an infection, or a cancer where our certain cells of our body suddenly decide to multiply out of control, or whether it is arteriosclerosis, the hardening of our arteries, diabetes, high blood pressure, you name it. It is actually inflammation of the cells for that particular organ. Liver cirrhosis. The liver cells are definitely inflamed, and you name it. So it really affects, and it's unhealthy. It's unhealthy for all of our organs. And the reactive oxygen species. So those, we hear a lot nowadays about, eat a diet rich in antioxidants. Yeah, that is extremely important and healthy. But unfortunately, we might be producing a lot of our own oxidants if we have a lot of accumulated adipose tissue in us, because that is what they do. Okay, so that was just to talk about fat cells. And interestingly, another thing is that here we say, so they're saying, so this is the American Heart Association, AHA. They've made a statement, and they say, so there was an article that they published called "The Importance of Assessing Cardiorespiratory Fitness in Clinical Practice, a Case for Fitness as a Clinical Vital Sign." And so here in yellow, they say, cardiorespiratory fitness is a potentially stronger predictor of mortality than established risk factors such as smoking, hypertension, high cholesterol, and type 2 diabetes. So they were considering and suggesting whether we should introduce people's level of fitness as a sign. Just as you have, when you go into the doctors and they check your blood pressure, your heart rate, your saturations in your finger, they put a little probe, and then they what else? Check your respiration per minute, your blood pressure, your blood sugar. They're saying that could there be a way that we could quantify and have some kind of standard quantification across the board where we could rate people according to their levels of fitness. And why? Because it gives us as clinicians a better clue as to what kind of patient we're dealing with, what are their risk factors, and And yes, so it's interesting that this is something they suggested. How one would go about measuring that would be another discussion. Some tips. Okay. At this point, just before we move on to tips, I just wanted to ask if anyone has any questions or doubts at this point, or if we're good. No one?
Can I just ask a question there, Rebecca?
Yeah.
Just while people might be thinking, just to take you back a little bit, you mentioned social prescribing. So from what I can understand what you're saying, it can be that we can actually be prescribed exercise as part of healthy benefits. How would that work? How could someone get involved in that, or how can we get involved? How does it work?
Involved in being a person who can prescribe it or being prescribed to?
Being prescribed to, I was thinking.
Right. Well, it's something still new. Okay, it's early days, and it's not only by a doctor, but these social prescribers can be occupational therapists, they can be nurses, physiotherapists, so they need to be accredited to prescribe, and so there are not many out there, unfortunately, here in England. And so they would and the people who decide to sign up to be a social prescriber are generally people who have an interest already in lifestyle medicine, for example, which is also not an official established specialty here in the UK yet. However, it is in North America, South America, and different places of the world. So yeah, I think something that I've been trying to push forward. And the awareness has definitely been increasing in the past few years, but it's still early days, and then we're taking baby steps, unfortunately. And it goes from if we're thinking about the GP, it's from some GP surgeries are actually quite geared to more natural ways of addressing illnesses, and so some GP surgeries have even run clubs with some of their patients. Like every month they have a run club and different things, and they do even activities, they do cooking clubs. I know some GP surgeries who do these things and others don't, and so it's very hit and miss, and it depends on what your GP surgery is doing and what you're interested. But if you do ask your GP whether they can always refer you to the closest local place who offers any support for healthy living. And because there are certain other independent companies, I know here in Kent we have something called One U, and they also used to have what's the name? These are, I forgot now. I will try and I'll try and remember and let you know, Gary. But they are third parties who provide these services and these benefits and and guidance and also practical things.
Okay, excellent. So the first point might be for someone to speak to their GP, ask whether their GP practice is involved in social prescribing, and if they are, then we can follow through that process. So first point of call then for those listening is have a word with our GP and see if they can signpost us. Yeah,
absolutely.
Just before you move on, we've got one other question that's come up in the chat, and if I've missed the question, my internet went AWOL for a little bit, so I had to come off the line. So if anyone did put a question in there that hasn't been addressed, please post it again. But we do have a question which is saying, can you be obese and fit? So is that something you can pick up now or at the end, Rebecca?
I could address, I could just mention, well, I'm not entirely sure exactly what that person means, but basically cardiorespiratory fitness would be measured by the strength of your heart, your lungs, and your muscles. So they haven't here, based on this slide, they haven't set out their criteria for how they would be defining cardiorespiratory fitness. So I wouldn't have that answer specifically because, say, for example, I don't know if they would only consider fitness to be, say, being able to go one flight of stairs and then recover their breath in less than 5 minutes, for example. That's one of the signs, because recovery from exercise is definitely a sign of fitness. So the quicker people are able to recover after a period of intensity, that is a good indicator how their heart and lungs are doing in terms of cardiorespiratory fitness. And so the person could potentially be carrying a lot of extra weight on them, but still be able to recover quicker. They would definitely be able to recover. They could be able to recover quicker than a very slim person who is extremely sedentary and just sits on the couch and watches TV every day. So yes, they could be, their heart and lungs could be more fit than somebody who is very skinny. Yes, it's possible. So I don't know how they would measure this, again, because I think it was a novelty approach and something they were just throwing it out there and suggesting. I don't think it's actually being practically started, but it's a very interesting and good question.
Okay. All right. Hopefully that helps, Janet. So we'll continue. Let Rebecca continue with her slides, and then we've got time for more questions at the end of this. Thank you.
All right. So I can give you a little exercise prescription now for anyone who's interested. So how often? A lot of people ask how often, which kind. Well, guys, to be honest, you do what you enjoy doing. Number one most important thing, which is not on the slide, okay? But let me talk about the slide. So how often, this is just a kind of rule of thumb general, okay? How often? 20 minutes 3 times per week, minimum. This is literally minimum, and it's not even according to NICE guidance. It's not according to government. Actually, the government advises a minimum of 150 minutes a week of moderate intensity exercise. The last time I checked. This is me. This is my suggestion, just based, and I'll explain to you why. So outdoors, why? Because you get the added benefits of health, isn't it? You get a better, more fresh air. You get sunlight. You also, looking and seeing nature around you has been proven to be very cathartic as well, observing and admiring nature. So you're getting all of that. And when in the morning is the best time, and why? So basically here I have a little flow chart that explains a bit. So what's the best thing to do, really? Say you eat a small amount the previous night, or really every night. We should all be eating small amounts. And then when you wake up, don't eat before exercising. This is an interesting tip. So you drink water, drink at least, really, at least, I would say between 250 or 500 mils of water on an empty stomach when you wake up. So you don't chug it, but kind of slowly wake up, and as you're waking up, try and drink half a liter before you exercise. Really, that would be very important. I would suggest not to chug it at once, but kind of slowly, have your bottle next to your bed. Once you wake up, start drinking it. By the time you changed and you're ready to go out, then you would have finished it. You could even drink more than that if you're able to. So then you do your interval training, which I'm going to talk about now, which is actually proven to be most effective, interval training. And what happens? So the blood glucose, and I'll show you now a sequence of what the physiology and the chemistry, what happens is that the first thing is that your blood glucose will be used up, and you're not going to have much of it exactly because you still didn't eat. And so this is how the body consumes glucose, because basically glucose, or sugar, actually gets converted into fat, okay? Which is, some people unfortunately still nowadays think that if they eat fat, they will get fat. But actually it is sugar that converts into fat. Of course, very unhealthy bad fats can also have that effect, and a very oxidative, it puts the body into a very oxidative state. So you use the glucose from the blood is used first. And then as you continue exercising, then the body will start using the glycogen in the muscle. Glycogen is just another way for glucose or for sugar. And then it will start using the liver glycogen, okay? because it is, again, glycogen is basically the long term. This is like the long chains of sugar. Their name is glycogen. The sugar gets stored as glycogen in muscles and in the liver. Okay, and so the liver, and then once we burn the small molecules of sugar in the blood available there, then we moves on to burning the ones in the muscles themselves, and then it moves on to burning the excess fat in the liver, and then when you eat breakfast after you finish your exercise, you won't shunt. What do I mean by shunt? So basically, what happens with us, okay, guys? Why is it that, does it matter? Sometimes some people say, oh, no matter what I eat, I'm just going to get fat anyway. Probably just go straight to my hips is what people say. There is a sense behind that. Some people say, what do they say? A minute on the lips and a lifetime in the hips, or something like that. So actually there is some sense behind that saying, that if you eat and you ate at the wrong time and you were not hungry yet, actually what's going to happen is that what you ate, because the body prioritizes, so okay, the bloodstream is already full of sugar, can't go there, the muscles are already full of sugar, so then the liver is also full, so then it just goes and stores directly into the fat cells, you see. And so the best way, and this is why it takes time for people to actually start burning their adipose tissue, because it takes a few weeks for your liver glycogen to start shrinking. The body is only going to start shrinking your adipose tissue and your fats around your body once your the sugar in the liver has already begun shrinking. And this is our aim. We all need to strive for breaking down some of that liver glycogen, because until we don't do that, we're not going to start burning our peripheral fat stores, because fat is also stored inside the muscle and inside the liver. And so this is a great important tip that a lot of people don't realize, and I can explain a bit further with some pictures. So you start exercising. First thing, you burn very quickly the sugar that's in your blood. You continue, let's say somebody's jogging. So they're jogging and they quickly burn that little. So why one of the reasons why exercise in the morning, not only your metabolism will be high the rest of the day, but also because eating on quote unquote an empty stomach, you already skip that first step because you already have no sugar in your blood anyway. But that's why how come I'm able to exercise strenuously in the morning before having eaten anything if I don't even have any sugar in my bloodstream? Well, it's because your body is using the sugar that is in your liver. You have sugar stored there and inside your muscles, and that's the sugar that is keeping you going even though you haven't eaten for quite a few hours. You're not going to faint. Don't be afraid or scared. You're not going to faint unless you have some other kind of health problem or health disease, okay? So again, this is on a case-by-case basis only, guys, okay? I cannot prescribe generally to everyone. So this is what keeps you going, that you're taking the energy from within the muscles themselves and from within the liver. And then after it burned, see that chain, that's the glucose, or also called glycogen. Once that chain starts breaking, which a little bit of it breaks every day, but until the chain needs to shrink enough a few weeks later before finally the body starts breaking up some of that fat globule inside our adipose cells in the peripheries of our body, you see. And just for comparison, just to show you, that is how like a normal cell should look like technically. But you see the one in the middle of the screen on the left, that whole yellow is a pocket of fat, of tissue, because they can really stretch. These adipose cells, they can really stretch and really accumulate a lot of fat tissue in there, okay? So that is the chain. So why do we recommend interval training? This is the last thing that I will say, pretty much the last concept. before we answer questions, okay? Interval training, why is it so good? Guys, another amazing thing that I would like to tell you. A lot of people talk about HIIT nowadays. Probably most of you have heard of HIIT or Tabata. HIIT stands for, so HIIT, high interval intensity training, I think. Yeah, HIIT. Why is it so good? Well, simply, I will give you the headline and the main reason why. Essentially, HIIT is good because you burn just as much fat in the rest periods as you burn in the active periods. Why and how? If you bear with me and if you remember a little bit of high school chemistry here, I will explain to you. So basically, it started, there is a Dr. McGuff, he wrote a book, and he was one of the pioneers of HIIT, if you like, and he wrote and spoke a lot about it. So what is HIIT really? What does that mean? So his initial model was you do let's say you're jogging, and so you run as fast as you can, for as long as you can, for 30 seconds, he suggested. Run as far, you sprint for 30 seconds, and then you walk for 90 seconds. And then again, you sprint for 30 and you walk for 90. And that was his suggestion. And he suggested to repeat a cycle 6 times around. Okay. But then since they have found out you can play with it, you can play with those numbers. It doesn't necessarily need to be fixed exactly those numbers all the time. You can do 30 minutes active and then a 10-minute rest in between, or 40 seconds, seconds, I meant. So 40-second work and a 20-second rest, and 40-second work and a 20-second rest, for example, and do that as many times as you're able to, depending on the workout routine that you're going for. So, and that's why some places call this Tabata as well, because he was somebody who trained skating Olympians, and this is how he trained his skaters, and they just had an increased stamina and endurance. They just had that edge, and pretty sure he's Japanese, and they would win a lot of medals because they just had that extra edge in comparison to the other competitors, because he used to train them and use this method of interval training. And so it looks very busy and scary, this slide, and I'm just going to, so yes, I will explain. All right, so essentially why, how come we burn just as much or actually more during the rest period? I mean, that sounds brilliant. I want some of that, burning fat and burning energy whilst I'm not exercising. Brilliant. Why? Because basically you're burning the glucose, and this is a chain of reaction. You start off at the top with glucose, and it burns into something called pyruvate at the bottom. Pyruvate turns into lactic acid, lactate, as you can see at the bottom. Have you guys, anybody, when we feel that pain in our muscles after we are exercising a lot, and the muscle hurts so much, and you have to say, stop running because my muscles were hurting so much, that's lactic acid accumulating inside your muscle. Lactic acid is very, very painful in the muscle. Okay, and so that's fine. You run until your muscles are hurting so much, you need to stop. And then when you stop or you walk slowly, what happens is there's that little circle in the right bottom corner called TCA. This is the TCA cycle, or also known as the Krebs cycle. This is where we have aerobic respiration. What happens there? During your period of rest is when you can breathe better, oxygen comes in, and you actually release 36 units of energy there. In the whole other the vertical equation there only yields 2 units of energy during that whole process. Okay, so you might have been working really hard. You were working really hard there, but the thing is that you accumulated by pushing yourself to say, when we sprint, we are exercising anaerobically. We're actually exercising pretty much without oxygen. We're just forcing and pushing ourselves, okay? And then, so when oxygen is not present, you cannot burn energy, okay? Cannot burn too much energy. And so it's okay to do that because you produced a lot of pyruvate and a lot of lactate. And then when you give yourself a moment, all that lactate will the oxygen, then you breathe in the oxygen will react with the pyruvate and the lactate, and you'll go through a long chain of reactions, and so it will produce a lot more energy. And so that's why during the rest periods you release those 36 units of energy, and that's the aerobic respiration, as in comparison to the anaerobic respiration. But you see, they're both necessary though. Okay. Also, I'll just rest forever then. No, because you need to produce, you need to act, you need to exercise in order to produce the pyruvate in the first place before it can enter into the Tca cycle or the Krebs cycle, as we know in chemistry. Okay, so this slide here just explains, just writes down what I mentioned. More pyruvate can be used, the body stores it as lactic acid, and then it feeds it into the Krebs cycle. And so this is happening, by the way, this chemical equation happens inside every single one of your cells in your body, okay, when they are exercising. And so lots of little cells just releasing energy, producing energy, you see. And so that's why we actually feel more energetic, because our oxygen stores, the whole body becomes more oxygenated, which is one of the reasons why we feel more awake, more revigorated after that. But not only straight away after the exercise, also later, because in the long term, your muscles will become stronger and healthier, and your organs will increase their capacity of storing some oxygen in them as well. And that just generally chronically will give you more strength in between each exercise session that you have. And yes, so last slide really here is this guy named Dr. William Roberts. He was the chief editor of the American Journal of Cardiology. And you can imagine just how much exercise impacts, a cardiologist. And this is what he said, how he defined exercise, really. He said, and I can kind of translate some of those words. So lipid lowering, so of course it reduces the fats in your blood. Antihypertensive, lowers your blood pressure. Positive inotropic, negative chronotropic. What does that mean? Positive inotropic is what we spoke about. It actually makes each heartbeat stronger. Negative chronotropic, therefore you need to beat less times. You will be less tachycardic. You're tachycardic whilst exercising, but in between and at rest, you will have to pump less often because each pump is stronger. It is a vasodilator. Very good for several reasons. Again, opens up blood supply to reach other organs. It's a diuretic for those people who have issues with water retention and they need to take water tablets. Well, you don't need with exercise. Anorexigenic, what does that mean? You actually feel less hungry. Interesting. Maybe in the first few days or 2 weeks, when your body is learning and adapting to this new thing that is starting to grip its mind. Okay, so we exercise now. And so then initially, first you might feel more hungry, but later, if you just persist with it for a few days or 2 weeks, and you will see you actually begin to feel less hungry and requiring less food, and you will see that. Therefore, you will lose weight. It is cathartic, which I mentioned before, one of my favorite terms. It is hypoglycemic. It will reduce your blood sugars, and it will improve your diabetes. It is tranquilizing, hypnotic, and antidepressant. So really, imagine if you could put that in a pill. Imagine if there was a pill. I mean, the patients that need these benefits, they are in a concoction. They literally have about 10 pills for that. Imagine if somebody could produce and they could tell you, listen, you take this one pill and it will give you all these benefits. You just swallow this one and you will have, that's it, all in one right there. You just one. And I mean, if somebody offered that to me, I would absolutely jump. And they tell me, by the way, there are no side effects at all. You know, we don't even need to, the box doesn't, the medicines box doesn't need to come with the little leaflet inside, because there's nothing to say. There are no cautions, no restrictions, no side effects, no interactions, no problems. And so just beautiful. So, you know, exercise is medicine, absolutely. And it is, if you ask me, the best kind, and most potent and most important kind. And so I think we're done, really. Actually, this was just there was another analogy. Well, this analogy is, I'll just finish with this, that lifestyle medicine, sometimes, you know, imagine you have a vase, a beautiful looking vase that is on top of a shelf in your bedroom. That vase is there, and what happens that, oh, the vase accidentally fell on the floor and it broke into pieces. And so what we say, oh, we can fix that with super glue. You know, we can fix that vase and pop it back together to pieces. You know, well, wouldn't it be interesting, perhaps, in trying to find out what was the reason why the vase fell in the first place? So if we glue it up, put it back on top of that same shelf, is there a possibility it might fall again? Yes, there is. What about, instead of trying to fix and patch up the vase, if we went and actually looked and analyzed the shelf a little bit, gave it some thought, gave it some time. Oh, it was wonky. Oh, because maybe there was a screw came out or something happened. Well, let's go and fix the shelf instead of going and trying to fix the vase. And this is what we're inviting you with this, with all of these inspired steps, with this series and all of these talks that we have in terms of, and the New Start acronym, and all the natural ways that we can contribute to our own health. And so it is really an invitation for us to put our thinking caps on and start asking why, start thinking of the cause and try treating the cause and not the effect. And so, and I hope you guys have been inspired.
Excellent. As always, thank you so much for that presentation. Wonderful. As always, Rebecca, so much food for thought, and a wonderful way to end the presentation as well. Why should we not consider some of the issues that we encounter beforehand? Yeah, are there things that we can do, exercise being one of these, to help us not fall off the shelf, not break ourselves into pieces? So excellent once again, Rebecca. I know that we have been joined by our physical trainer for this evening. For those of you who have joined us a little bit later on than we started, we've explained that we're going to shortly be having a session, a fitness session, which I can see Leon there. Leon's just giving us a wave. Good to see you, Leon. So Leon will be leading out in some exercise, which you can have your cameras on. For those of you who are brave enough to switch your cameras on, that'll be great. If you want to join in without the camera on, that's perfectly fine as well. But before we do, we just got a couple of minutes to ask Rebecca any final questions. I can see one in the chat, which is, how does exercise lower cholesterol? So is there a specific way that exercise, or how does exercise lower our cholesterol?
There are different ways, different mechanisms. One of them is the fact that when we are exercising, when we are burning the accumulated old adipose tissue that is deposited in our peripheries, and that releases and kind of reduces the bad kind of fats. We all need fats. They're very healthy and essential to our survival. However, they're not all very healthy. So, you know, there are different kinds, but fat is very, very important and necessary to our bodies. But there are many different kinds. The topic on fats and different kinds of fats is a very huge one, and it takes a lot of biochemical explanations, but essentially, I guess if we put it in very simple terms and to summarize it, would be that exercise just helps to burn the bad fat, let's say, and it will burn it, and it would, if you like, quote unquote, will melt it, and therefore less amounts of that will be present in the bloodstream whenever we take our blood sample and a blood test, and therefore when it comes out in the result, the numbers will be lower of that particularly bad fat.
Okay, fantastic. Thank you very much. Okay. Any other question? Or Judith, Dr. Judith is with us. So Judith, do you want to ask your question?
Hi everyone. It was also just in response to the question about how does exercise lower the cholesterol. So I don't know if you, I'm really sorry, I joined a little bit late. I don't know if you'd mentioned it a bit early, Rebecca, but there's also the thing, Kathleen, with the fact that exercise itself for some reason causes the bad cholesterol, the low density lipoprotein cholesterol. You know, you've got good cholesterol and you've got bad cholesterol. It causes that to basically be taken up by the liver and basically removed away from, you know, the bloodstream itself. And also exercise as well, it seems to cause us to make proteins that do not bind onto the lipid or the fat in the same way, so that fat then is not then going to be deposited into your arteries and it's going to be got rid of. So there's lots of different ways, and I think as what Rebecca said, you know, it's kind of like a massive subject and there's so many different ways in which this process happens. And I think if we're being honest, we don't really need to know, we don't need to have a deep understanding into the actual step-by-step mechanisms. We just need to do the exercise, and that is the difficult thing, isn't it? Because many of us perhaps struggle with either the motivation or the stamina or whatever, but I think exercise is just absolutely massively important for us all, and I'm very much looking forward to this next bit where we can do some exercise. I will have my screen off.
Okay, did you hear that, Leon? We've got someone looking forward to this. So we just want to, first of all, before we go on to Leon, we want to thank Rebecca so much for your presentation. As always, full of information. Thank you for presenting that in the way that you have, Rebecca, encouraging all of us. We need to exercise. We know that for a lot of us, it's a challenge. Sometimes the motivation isn't there, but the benefits, we've been able to spell out some of these real term benefits of exercise. For those of you who are not aware, we will be putting this session on our YouTube channel, so we'll include that in the chat. So if you search YouTube Inspired Steps CIC, and you'll be able to capture the information from this session again and all of the other sessions that we've had in the Better Health program. So thank you very much, Rebecca. I know that you might need to leave us before the end. So again, we wish you all the best and thank you again. Right.
Thank you. My pleasure. Enjoy, guys. All the best.
Okay. Thank you. Thanks again. Well, before we hand over to Leon, we're just going to, as those of you who will know, we often give a prize at this time. And we've got a couple of lucky people who are going to be winning a prize, the first of which, it looks very much like this, but it isn't actually this one because this one's mine. Does anyone know what this is? What's this?
A water bottle.
It's a water bottle. A water bottle. Water is hugely important to our functioning. Okay, so somebody will be getting a sports, or two people will actually be getting a sports water bottle, as well as this wonderful thing. If I can get it up. So we will be having a second prize, which is this. Okay, not that we're not sponsored by Adidas. Can everybody see that? Unfortunately, we're not sponsored by Adidas, but we have an Adidas t-shirt in size large. Unfortunately, you can't pick and choose the sizes, but somebody will be receiving one of these t-shirts and one of these sports water bottles. And the first person is going to be FH, someone who's online. FH, are you still online?
Yes, I am.
Okay then, FH, I'm not sure of your name. Don't need to tell us if you don't want to, but what I will need you to do is if you can drop me a line in the chat, giving me your telephone number or your details, and we will make sure that this gets out to you, or both of those prizes get out to you. Is that okay?
Yeah, no problem. That is fine. Thank you.
Excellent. And our second person is Dalroy Francis. Is Dalroy available? Is Dalroy still on the line? Okay, Dalroy, are you still there? It looks like he may have gone, unfortunately. So sorry about that, Dalroy. Okay, then, so we'll move down. Michelle Johnson. Is there Michelle Johnson still online?
Yes, I am.
Okay, Michelle, how are you?
I'm good, thank you.
Good, good, good. So, Michelle, again, you'll be having one of these water bottles and one of the T-shirts. So if you could send us a message on the chat, send it to me directly, and then we'll be in touch with those. Is that okay?
Yes, thank you.
Excellent. Okay. Right. So with no further ado, we're going to hand over to Mr. Blake. Leon, over to you, sir. Do you want to just give us a quick explanation of who you are, Leon?
Hi, guys. My name's Leon, as Gary's already said, and my day-to-day job is I'm a primary school teacher, but my background has been in sports. I've played at a semi-professional level of football, so a decent level. I played for counties and districts as I was growing up, but trying to just stay fit and be healthy is a little bit of a passion of mine. So I've tried to combine my teaching and my fitness background and kind of put it all into one. I've joined a close friend of mine, and we have a boot camp style fitness group called Fit, and we deliver like boot camp sessions. And obviously through the lockdown, we've had to kind of alter the way we do things, and everything's kind of been online. Gary has been a little bit of a mentor for me growing up. I used to coach his son, so kind of I know Gary through that way. But the things that Gary's been doing, I think, kind of work together with what I do. And my WellFit group, it's very much about well-being. So I think it was June that said about obviously people finding it difficult to get themselves motivated for fitness. And I would say that's one of the things that we kind of try to do in a way. And then again, just quickly following on from what Rebecca said about fitness, when she was talking about the technical aspects of it, and obviously she was going into the science, it was making me think, wow, I come from it from a completely different perspective, and I try not to really think too much about that, but just get myself healthy and fit. But it was really interesting to know that. And then she talked about the high intensity fitness, which actually is going to touch upon something that I do today, and the Tabata. But one of the reasons why people do that is because those short bursts of high intensity, people are able to kind of work hard for those shorter amount of times without thinking that they have to go for hours and hours. And then, as she was saying, those smaller rest times allow you to get the oxygen in, where you then start to burn, but then you go back to getting your heart rate ramped up to get working, and then it kind of brings you back down. So I always think about like a bicycle. If you were riding really fast on the bike and you're pumping, you get up to a top speed and then you stop riding, you'll still keep going and you'll go at a decent speed as you're going along. And it's at that time that you're still working. So even though you're not pedaling, you're still working. So that was just kind of a layman's term. So Gary's told me about fitness. I mean, delivering a session. I'm only going to have you for about a little bit over 5 minutes. Just want to kind of give you a little bit of a show of the type of things you can do. If anyone's kind of thinking, oh, I'm not really ready for jumping up and down, I've devised this workout so that it is very low impact, a little bit of strength, but a little bit of cardio. If you have a sturdy chair, something like what I've got in the background, and maybe a towel, a small towel of some sort, something you can hold on, it's going to add resistance. You're probably thinking, what's he on about? But it will become a little bit clearer. So what I'll do is I'll give you a minute or so if anyone wants to, but a sturdy chair and then just like a towel that you can hold on to small. I can see Gary thinking, what am I going to use?
No, I think I know. I am looking around. I'm looking around now. Okay, time to find something.
Yeah, just a minute and then I'll start up.
Okay, so if anybody wants to turn off your cameras, please do so. But if not, please join as you are without your cameras on. Yeah,
there's no expectation of having your cameras on. You can tell me what you think afterwards. I'm happy to answer any questions about the type of things that we do, but we're going to start with a Tabata. A Tabata means 20 seconds work, 10 seconds rest. I'm going to keep it as simple as I possibly can. We're going to start with like a jog. This jog, though, has 3 different parts. Just going to see if you can see my feet. The first part, you can just go like this. So it's just a step. So just keeping it in that position. Step 2, you're just going to lift up slightly. So your feet just come off the floor as if you're going into like a brisk walk. Step 3, and this is if you're feeling a little bit more adventurous, you can use your chair, but you're just going to go into that little bit of a jog. Pump the arms because it helps to get the heart rate going as well. So we're just going to go there. Okay. After that, the 10 seconds, then we're going to do a thing called gate openers. Now, if you're using your chair, just hold on to your chair. You're going to stand stationary. One foot is going to come up, across, and then push down as if you're putting your feet into a shoe. Back up that position and back round. Now, this foot will never touch the floor. So up, down, around. So we're going like that. We're going to do these twice through, but I'll keep explaining it. And then the next one, I'm going to use my chair for this, but you can do it standing up, and we're just going to think about some windmills, and all I'm going to do, swing my arms forward, stretch out wide here, back to my starting position. So we're working those shoulders. So he's just going to be up and there, like so. Okay, 20 seconds on, like I said, 10 seconds off. You'll hear the beep. We ready? Any questions before we start?
Okay, so is everyone ready? So I can see a few have been brave enough to come on the camera. Anybody else, there's still time to do so. But if not, please join in.
Yeah, okay. That's cool. Gallery, I'm going to put you guys in gallery view. Oh, so awesome to see so many people. Excellent. Okay, so let's get going. 20 seconds, off you go. But just into our jog. Just into our jog. Brisk walk if you want. Just into my heels, my tiptoes, but we're just into that jog. 10 more seconds. Pump the arms. Remember, I was saying. Okay, rest. As you're resting, don't stand still. Shake off, shake those legs. Okay, 1 foot now. Up and over and press down. Up, over, press down. So we're just there. I'm using my chair just to help me balance, and it's that foot that is going up and over. Try not to let it touch the floor. So we're just working. This is working the hips, working the glutes, and shake off, shake off. We're just going to go into our windmills now. So this is all arms. Okay, from this position, up, around, big, so you can feel it in the shoulders again. Once you've got that rhythm, I want you to step it up just a little bit. So you're there. Excellent. We've got it. Good. Rest. So we're shaking off. We're shaking off. So rest in 3, 2, 1. We're going back into our jog. Back into our jog. So now we're ready. That's it. If you're going full out jog, like I said, pump the arms, just gets that heart rate going just that little bit more. When we come out of the jog, remember, we've got 10 seconds rest, and then we're going to do the gate openers on the opposite side. Rest, stay on the bounce, take your deep breaths in through your nose, out through your mouth. We're going into the gate openers from the opposite side, and let's go. Up, over, push down. Up, over, push down. Try to keep your core nice and steady. Chest upright. Up and over. Like I said, glutes and hips. 10 seconds. We're going to go the opposite way. Start here, around and down, okay? We go in 3, 2, 1. There we are. Okay, excellent. If you feel, oh, I've got this, just speed it up for me. That's it. Big, wide movements. So all we're doing, imagine I was saying to you, I want you to do lots of press-ups. I'm now working the muscles around those areas, just so they're ready. 10 seconds, and you are done. If you've got a little bit of a drink, Get a sip now. Excellent. So that was just our warm-up. So now what we're going to do, I'm going to do a little bit of a total body review. Again, we're going to follow that 20 seconds, 10 seconds rest. If you've got any knee problems or anything like that, then the chair is what you use. So for 20 seconds, the way this is going to work, I'm going to break down the exercise that we're going to end up going into. To break down is so that you kind of understand it. We're going to do squats. Then we're going to do a press with the towel. Okay, we're going to do that twice through. Then we're going to finish with a bit of a cardio all the way through. Okay, so first 20 seconds, we're going to squat. I've got my chair here. Just in case you're feeling a little bit sore around the knees, I'm only going to go to as low as my chair. Down, back up, down, back up. If you feel that you're okay, legs a little bit wider, and you're going to squat down as low as you can and then drive all the way back up. So 20 seconds on the squat. After that, I want you to have your towel. But when you've got your towel, your arms are straight out, and I want you to hold the towel as if you're trying to pull it apart. So you're trying to rip it through the middle. You should start to feel that all the way through your triceps as if you're tensing. That is going to be your weight. And then from that position, I'm going to come all the way down to my chest, drive up above my head, all the way down to my chest, drive up above my head. I do not want to see the towel slack because that means you're not pressing and there's no resistance. Okay, we ready? Any questions? Good, good. Okay, let's go. 20 seconds of our squats. We ready? Let's go. Squats, 20 seconds. Awesome, awesome. Don't worry too much about your towel just yet, but make sure you have it ready. For those who are thinking this is easy, I want you to drive them out. Can you get that pace up? Oh, loving it. Keep push. 2, 1. Let's get my towel. Let's get my towel. Let's get that hold of it. Into my chest. Drive. Back. Drive. Keep pulling the towel. Excellent. Just going to come in as much as possible. If you can keep your elbows as close to your body as you drive up and put it down, that extra, oh yes. Good, rest. We're going back into the squats. Going back into the squats in 3, 2, 1, go. Squats. Let's drive them out. Excellent. Chest up. I say this to my campers, it is a bit horrible, but think about that toilet position. Yep. Drive up. Excellent. Rest. Get your towel again. Get your towel again. Nice and tight. Elbows in. Push. Let's go. Who can get 15 presses in for me? 15. So you're working as hard as you can. Let's push. Don't lose form. Keep driving. Keep driving. Keep driving. Excellent. Get yourself a quick drink because now we're going to go into our combination. Quick sip. Now I've noticed, and I can see those, I'm thinking you guys are experts. I'm thinking there's so many of you that pretending to Gary that you don't really like this fitness stuff, but you're really on it. I'm going to ramp it up to 30 seconds work, 10 seconds rest, but we're going to combine the squat and the press. This is, if you need to, this is where you use your chair. So I always have the towel in that grip position. From my squat, I come up and I press. Straight away, come down from the squat and press. So I'm here. Drive, drive, drive. We're going to go for 30 seconds, 10 seconds rest. Then we're going to go 30 seconds, 10 seconds rest. We're just going to drive it through now, okay? When we have our 10 seconds rest, we must stay on the march. So I'm now not giving you any rest. This is active rest. So drive, resting is here. That's where we are. Okay, 30 seconds, 10 seconds of a march. We go twice through. We ready? Everyone's looking ready. Let's go. From my squat, drive up. Remember, keep elbows into the body nice and tight all the way up and all the way down. If you're not using your chair, go as deep as you can. Keep that chest up and keep pushing. 10 seconds left. Keep pushing. Good. Feel that through your triceps, through the legs. Into my march, into my march. No rest for the wicked. We're going 2, 1, go. Drive. Push them out. Who can get 20? Don't rush. Even though I'm challenging you, make sure the form is good. Five, 4, 3, 2, and we're there. March, march. And relax. Get a drink if you need a drink. Now, one thing I always get from my boot campers when we're talking about our fitness and our boot camp, they're always talking about abs. They're always talking about the midriff and wanting to lose weight there. So I'm just going to do a little challenge with you. That's going to tighten up our core, okay? You probably will need your chair for this. You can sit down if you need to. So, going to show you my chair. With my chair. So, this is a little bit of a competition as well. I want you to be on your chair, but just on the edge. So you're going to go to the edge of your chair. Give yourself some balance. You're going to go into a slight recline position with your body, but then I want you to put your legs out like so. So I'm in this position. All we're going to do, hold, hold. 20 seconds, hold. We're not going to have a rest in this. After that 20 seconds, I'm going to go here. That's a flutter. 20 seconds. After that 20 seconds, I'm going to go into a tuck. Legs come in, both of them together, as if I was jumping over something. I'm tuck jumping. So we're doing 3 20 seconds, 1 minute abs challenge. Let's see if we can stay in it.
And Leon, is it okay to hold on the chair as we're doing it?
Yeah, definitely is. And like I said, Gary, I'm just going to quickly show this. If you are not on the chair, so I don't want anyone to think, here I am, my slight recline. I'm just holding my legs out. That's where I am. Hands are behind me, so I'm holding that. Slight recline, my legs, I'm holding 20 seconds. Then I go into my flutter. Then I go into my tuck. Okay, 1 minute. Core killer, I'm calling this. I'm going to call it a core killer. Let's see what we can do. No rest. 1 minute. Everyone's looking ready. You ready, Sylvia? Yes, Sylvia's ready. Good. Okay. Go. 20 seconds just of your hold. Just of your hold. Legs straight out. Toes pointing towards the roof. Slight recline. So just hold. Once you hear the beep, we're going to go into the flutters. Who's still in with me?
Yeah.
Go. Flutters. That's it. Keep those legs nice and straight. Make sure you're still in that recline position. Remember, use your floor, use the chair. Happy for that? Hold on. Give yourself that balance. We're going into the last one. Tucks. Tucks. So bring the feet in, drive them out, straight leg, and keep tucking in. We've got 10 seconds left. Who hasn't dropped out yet? Who hasn't put their feet down? Keep working. 3, 2, 1. And you are done. Awesome, guys.
Fantastic.
Absolutely awesome. Can I just ask, how was that? Did you feel like there was a little bit of a burn? Did you feel like, oh,
Really good. Thank you.
That was good. That was good.
The last
Really good,
part was
yeah.
hard.
so
Yeah.
please,
You
so
should have kept it up longer.
Wow.
Another 5 more minutes.
I
What we're
heard
going to
that
say,
part.
first of all, can we have a round of applause for Leon that's got us all going? Oh, we've been sitting here, he's been getting us so going. If any of you have been on our YouTube channel, you'll see some of the sessions that Leon used to do with Inspired Steps. So have a look at our YouTube channel and you can see the smiles. We used to sweat so much and have so much fun at the same time. So what I am going to ask a question. We're thanking Leon for putting some of what we've heard from Rebecca into practice. But just to ask a question, would you guys enjoy something like this on a weekly basis, perhaps?
Oh, yes, definitely.
Okay.
Yes, I would.
Yeah.
If you would, want either put your details for us in the chat, and then we're gonna see what we can do. We're gonna have a chat with Leon and see if we can try and get something going on a week by week basis. Okay, so put your details for us in the chat, or look out on our YouTube channel or at our Facebook at Inspired Steps CIC, and we'll see what we can do. Is anyone else?
Sorry, Gary, when you
yes,
sorry, Gary,
Sharon?
when you say details, you mean our email address?
Email address or telephone number. If you don't want to put it on there publicly, then just send it to me directly. That's going to be probably better. Yeah, send it to me directly, and then that'll help us keep in contact with you. If not, please keep a look on our Facebook page and our YouTube channel, and we'll try and get something up as soon as possible. Is anyone else out of breath a little bit, or is it just me?
Yeah.
Okay. Just a little bit. I thought it was just me.
Gary,
Yes, sir.
Just on that, I wanted to kind of show that even though I'm asking you to work from your chair, even though we probably only worked there for about 10 minutes, you can see I can see the glisten on people's faces. I've got my towel, like nature hasn't been kind to my head, so I'm having to wipe away that sweat. So what I'm saying is, fitness for everyone doesn't have to be, oh, I'm running out, I'm picking up 100-pound weights. I think as long as you are active and you are moving, that's the main thing. Getting to know myself. I'm not someone who's big on diets and things like that. I just think exercise makes me feel happy. I get to meet lots of great people through it, and it just gives me that little bit of an accomplishment when I've finished it. Like someone said at the end, oh, that bit was hard. I always, at the end of mine, call it a finisher. And they're like, well, everything else was a finisher, but you brought yourself to here and we're just going to tip it over. And it's always good because then you think, wow. And it's a good marker because if you were to do that, you could probably do a timer yourself, try that again. And I bet you within a week or 2 weeks' time, you'll be like, that now feels easy. What I would say to you then, ramp up your time. Just put your time up more. So you're looking at that. But yeah, that was fantastic.
Excellent, Leon. Excellent. Okay, well, time is running against us, but has anybody got any specific questions for Leon? We've got Dr. Judith on as well still. I know Rebecca's had to leave, so we can have a medical. Don't worry, Judith. We're not going to ask you about exercise generally. We don't want you to be too far out your depth. But if there is anything on the physiology, or asking Leon about any of the specifics of exercise. Has anyone got any questions they would like to ask Leon or Judith on exercise, types of exercise, duration? I think, like Leon said, that. Oh, is it someone wanted to ask? Any questions? All straightforward. Okay.
I have
yep.
one. I have one.
Go on then, Judith. Yeah.
So I had some abdominal surgery about 3 years ago, and my core is just jelly. There's no core muscle, no core strength. And I found that particularly the last exercise is really difficult to do. So I was just wondering, do you have like any like beginner ones, like more less advanced than the ones you did, to start strengthening the core up again?
So when it comes to things like that, like myself and my partner, we try to do as many adaptations as possible. Yeah. But in terms of things like that, what I would do is maybe just reduce the time that you're doing it. So I've asked you to work for a minute, but do you know the one where we just had the legs out straight?
Yeah.
You may just think, I'm going to set my watch and see how long I can do that for. Okay. And your tester would now be, oh, I got through the 20 seconds, but don't change that. Do that 20 seconds continuously. When you feel like that is just way too easy for me, I would now go to 30 seconds and 40 seconds. Gary will ask you, when we used to do the fitness, I used to put everyone into a plank, and then I would just set the timer. And when you go down, that's your time. Mm-hmm. But then 3 weeks later, I would do the exact same thing, but I would say to people, you try to work on that while you're at home. So I would say to you the exact same thing. It could be the leg straight, it could be the flutter, it could be the tuck. Just do one of them. Think, how many could I get out from that? And then challenge yourself to go that little bit further. So that's what I would do. No weight bearing, just kind of make it body weight, keep it nice and simple. Like I said, let the timer be your measure of the strength that how you're going.
Okay, excellent. Okay, thanks for that. I'm just checking if there's one more. No, I think the rest are just, seems that everyone's interested in the exercise session, so that's brilliant. Brilliant. We'll definitely get that in line. We've probably got time for one more question. Any other specific question? No. And Leon, yeah.
I just wanted to say, where did you get all these great people from, Gary?
I know. It's called bribery. That's why we're giving people water bottles and cooking books and things. No, they've been really good participants from week one onwards. I'm really glad that so many people have stayed on. I know that there was probably a third of us with our cameras on, but I'm pretty sure that the majority of people were doing those exercises as well. So really well done. And thank you once again for that, Leon. So we're going to conclude now because we've just gone past 8:30. Thank you all for your details of those who would be interested in a weekly exercise session. It's something that's been on my mind for a little while, so we're going to try and do what we can to get that rolling. But we would remind you that we've got one more session in this Better Health series, and Dr. Judith will be leading out next week with a session on rest, sleep and rest. Is sleep and is rest important in our physiology, in our makeup? And yes, give up, man, give up. And yes, it is. Yes, it is very important. So Dr. Judith will be helping us understand, why do we need to get to bed on time? Why do we need to sleep for a certain amount of hours? Is it just to be boring, or is it going to be helpful to us? Thereafter, we are going to have probably a week's break. And then we're going to have two final sessions, which are going to be about mental health and mental well-being. We're going to look at what are some of the positive things that we can do to increase our mental well-being. what are some of the positive thoughts, what you know, some of those things that will help to benefit us with our terms of our mental well-being. So that will take us up to the end of March. In the meantime, I'm going to have a chat with Mr. Blake and his colleagues at Well Fit Training, and we're going to see what we can do to get some regular fitness sessions going. Does this night of the week work for everybody, or another night of the week, or are people flexible?
This is fine.
This is good. Yeah.
Okay, we've got some that are
Yeah,
flexible.
this is good.
Okay,
Yeah,
all right.
fine.
Well, let's see what we can do then. Let's see what we can do, and we'll be back in touch about that. So please, I've keep being told to remind people. Apparently, we're asking you to like us. Is it like us or share our Facebook page? Is that right, Leon? What is it?
Like, share,
okay.
comment.
That's the one. Like, share, and comment our Facebook page, which is Inspired Steps CIC. You can visit our YouTube channel, Inspired Steps CIC, and I think you can, if you subscribe to that, that will give you any regular uploads, including this one, which will be online within the week. So thank you very much for participating. It's been good fun. Hopefully we've enjoyed it. I'm sure. Can we have a thumbs up for those who are there? Anyone enjoyed this evening?
Yes,
Excellent.
sir. We enjoyed it. Thank you.
Excellent, excellent. Thank you so much for that,
Thanks,
Leon.
Gary.
No problem at all. And we wish you all a good night, and we will see you all very soon.
Hopefully see you soon, guys. Bye-bye.
Okay, Leon, thanks very much.
Thank
Then.
you. Good night. Bye.
Thanks very
Good
much.
night. Thanks. Thanks, Gary.
Okay, then.
Thanks, Leon.
Glad you all
Bye,
enjoyed.
thank you.
Have a good night. Take care.
Bye.
Thank you, guys. Thanks, Leon. That was really challenging for me. So I will definitely be practicing them exercises. So
Oh, yeah, awesome.
It was really interesting for you to say, oh, you know, there'll come a time when you'll be able to do it for longer than 20 seconds. I'm not sure, but I will try. I definitely.
No, 100% you will.
Thank
Believe.
you so much. Take care.
Take it easy. Bye-bye.